The Patient Protection and Affordable Care Act, also known as healthcare reform, has raised a lot of questions, and Highmark is here to help provide you with answers. Of immediate interest is, what happens on September 23, 2010? September 23rd is a key date for healthcare reform. This date is when the first major wave of healthcare reform provisions begin to go into effect, although your employer-based group health plan may not be affected until sometime later. Here's a look at the provisions that will impact just about all employer-sponsored group health plans within the next year. These provisions are effective on the first day of a health plan's new plan year on or after September 23, 2010. So these provisions will affect your plan on the first day of its new plan year on or after September 23rd. That might be a date sometime in the fall of 2010, or it may be in 2011, depending on how your plan year runs. Many plan years coincide with the calendar year, so they begin on January 1. In other words, within about a year of September 23, 2010, all employer-sponsored group health plans will need to comply with these provisions. Now, there's a second batch of provisions related to September 23, 2010, but because of a factor called grandfathering, some group health plans will not need to comply with these provisions. Grandfathering means that if a health plan was in effect on the date the bill became effective, March 23, 2010, and it chooses to keep that coverage largely intact, it is exempt from certain healthcare reform provisions. The following are the September 23rd provisions that affect all employer-sponsored group health plans except those that are grandfathered. Now, there's a lot more to know about the healthcare reform provisions that we've just covered, and that's where this website, HighmarkOnHealthReform.com, can really help you. For each September 23rd provision, the website answers these questions. What is the provision? How does it affect you? What can you expect? What's your next step? What is Highmark doing to help you? And where can you get more information? The website also includes numerous multi-page close-ups that really drill down into the details of the provisions, so don't miss them. You'll find the close-ups on the employer landing page. And employers can also contact their Highmark client managers who can readily help with their workplace's healthcare reform questions. Healthcare reform is complex, multifaceted, and in some cases, fast-moving. That's why, as always, Highmark is here to help.